In this video, I'm going to be telling you about the Ontario HIV Epidemiology and Surveillance Initiative. This is a new initiative that was formed to support the provincial HIV strategy for Ontario and represents a new collaboration between 4 agencies: the AIDS Bureau at the Ontario Ministry of Health and Long-Term Care, Public Health Ontario, the HIV Treatment Network, and Public Health Agency of Canada. So what are we trying to do? Well, we're trying to understand, monitor, and translate the epidemiology of HIV in the province of Ontario in order to understand the challenges along the prevention, engagement, and care cascade, to inform local and provincial policies and programs such that services can adjust to meet changing needs, to provide the information needed to develop, implement, and evaluate strategies and interventions, and integrate that evidence into practice, and to monitor our provincial progress in achieving the goals of the strategy. What are we hoping to achieve by this? Well, we're hoping to achieve better access to timely, relevant, and comprehensive information about the epidemiology of HIV in Ontario, and to disseminate this information more widely to the stakeholders who need to know it. So who are those stakeholders? Well, first, we have people who are living with or at risk of HIV. Then we have AIDS service organizations and funded programs, public health units and community health centers, clinicians, clinics, and other service providers who are delivering care to people with HIV, researchers, policy and decision makers, local health integration networks, and the general public. So how are we going to do this? Well, our primary emphasis will be on the priority populations that are affected by HIV in Ontario. These are people living with HIV and AIDS, gay, bisexual, and other men who have sex with men, including trans men, African, Caribbean, and Black communities, including people from HIV endemic countries, Indigenous men and women who use drugs, and at-risk women, including trans women. So we'll be doing this by really centering our activities around the cascade of prevention, engagement, and care shown here, which includes people who are vulnerable to HIV and prevention through diagnosis and onto treatment and suppression, as well as issues related to comorbidities and aging. Now, underlying the cascade, we know that there are a number of systemic factors that can influence risk, and these are at biological, individual, social, and structural and policy levels. So this will be the framework that we'll be using for OHESI, and we'll be examining data across this framework using a number of different lenses, including the priority population lens, as well as by region and by demographics. So that brings us to the end of our tour. So we've developed an online knowledge hub for provincial HIV epidemiology and surveillance information at www.ohesi.ca. We'll be releasing new information as it becomes available, and please join our mailing list to be notified of updates. Thanks for watching.